commander at my last location. So, but it's the team here that's making it all happen. So, all right. Thanks very much. All right. One last chance. Anything? Anyone want to say anything? Chief, you got anything?
I just wanted to reiterate, obviously there were a lot of questions scrolling through tonight, and I just want to assure everyone in here that every single question, like Colonel Tully said earlier, every single question that is up here will be addressed. There will be answers provided to those, and they'll be provided online to you. So if you asked a question and it wasn't answered in this formal setting, it will be answered.
You got a question? Yeah. Yes. There should be a...
I'd like to have a class on how to protect ourselves or recognize if we were being exposed to Ebola.
We thought that question might come up. So, Kevin, if you...
As the non-physician in the room, no, Ebola right now is you shouldn't be real worried about the Ebola. It has to be transferred physically. So right now, if you're worried about that, we can put the class together if you'd like. So if you'll send me an email, we'll be glad to set that up and we'll put it on Facebook as a class. But there should not be a overly concerned about Ebola, and we can provide a class for you.
Colonel Blocker's here.
What is your email address?
There's the physician in the room.
Okay, so I think it's important to frame, Ebola happens to be what's in the news at the moment, but what you're really talking about is how do you protect yourself from the spread of infectious disease, particularly in a society and environment, in a world where it's so easy for folks to travel, and just like counterterrorism protection at the airports and things, I mean, it's really the same kind of issue from a public health standpoint, and that's really an international problem. Our folks at CDC and World Health Organization are involved with, but it starts and ends with, when it comes to personal protection, there's risks of passing cold viruses and other things, much more commonly, much more likely than Ebola specifically. So we have a lot of education that we provide to our providers and our medical staff to help recognize how to best deal with what emerging threats like Ebola, but also the more common threats around our area, including even seasonal threats like mosquito-borne disease like St. Louis encephalitis and some of those kinds of things that can potentially happen in the area at different times of year. So for this specific Ebola threat, as Colonel Frankie said, it's a contact threat. You have to literally come in contact with blood and body fluids from someone who has active Ebola. And being a hemorrhagic fever, you can take that all kinds of ways with, and when we have in the past with movies and things like that in the media. So Ebola is a concern, but again, good general protection, personal hygiene, when you're using out in the public areas, whether on base or off base, good hand washing techniques are probably the best thing you can do. When you're touching common things like doorknobs and things like that, if you use your sleeve to push open a door instead of your hand, you're using a common phone or other things. There's lots of ways to do that, right? To help protect yourself in the environment and the community. So anyway, for standpoint, good personal protection is the key there. And we can definitely offer some more available from a patient standpoint.
Do those little germicide cloths that they have, like at grocery stores, do they make that much difference?
Well, any type of sanitary wipe can help. You got to you look at that hand sanitizer, Clorox wipes. There's all kinds of different things that you can definitely use, but you start with your personal space. And then you extend it when you're in a public area. You look at what are those common things that you might be exposed to and how to protect yourself.
Thanks, Dave. Appreciate it. All right, so there was one, do we have spouse connection in any way? That's not a program or something from one of the other services that I wouldn't be familiar with, is it? I think if it's a general question about how to connect with spouses, our Airmen and Family Readiness Center can plug you into any organization, spouse group on the installation. And if you're in the Air Force, there is a key spouse program that you can take advantage of. You can also go online, look through Facebook. There are more spouse Facebook pages. Yes, ma'am.
are spouse clubs that are available. I'm actually the president of the Enlisted Spouse Club. And then we also have the Officer Spouse Club that is available for those people who are asking.
Great. Thank you very much. I know they're both incredibly active and vibrant, from what I understand. All right. Did we answer the question about NAH not being enough to cover this? I'm not sure I understand this one.
Sir, that's
BAH not being able to cover
BAH,
this area.
yeah. They're referring to basic allowance for housing in the community, and how that's done. For those that do not know, is the Defense Department has a contracted agency that evaluates every BAH area. We submit the rental properties that are in the area to this company, and then they take utility, insurance, and then rental rate information and come up with a calculation for each rank band for their particular BAH. So they're saying it's not enough to cover this area, and it really depends on probably the individual family and what they're looking for. They may not find the 3,000 square foot house for $1,200 here in South Tampa, but you may be able to find that in Brandon and Riverview and places like that. So not really sure what they're getting at. There's plenty of BAH for each individual rank band to rent a place, and you pay utilities and then also pay insurance out in the community.
All right. Chief, do you hear anything from our young enlisted folks, whether is it...
I haven't heard too many complaints along those lines. And
right.
I was just wondering, the way I read one of the questions earlier is, I think they're curious if certain areas over others might be skewing the BAH numbers. So are they concentrating and rolling in one section that might be bringing that BAH down or driving it up?
Not at all, Chief. The houses that we take the sampling are from all over this community. We go as our survey area is all the way up into Pasco County and goes also all the way down into Bradenton and includes Pinellas and Hillsborough County as well. So we have a very large area that we cover. So there's a sampling of all over, everything from the homes that are over in Pinellas that are closer to the water, which you could probably imagine is a little bit more expensive, to the things that are out in the out where I live, out in the country, where it's a little bit more reasonable. So we have a peanut butter spread across this whole entire area. There was a question that was up there earlier about paying their BAH amount for a 2-bedroom, 1-bathroom, and it's really dictated by family size, not dictated by how much BAH you make. So if you are a 3-bedroom entitlement, for example, your BAH covers a 3-bedroom. If you're a 2-bedroom, it would cover a 2-bedroom or a 4-bedroom and so on.
Okay.
It's
Good deal.
based on family size.
Thanks very much. So the speed limit signs, got that one for action. We're going to see what we can do and get some feedback on them. Last question, will the fitness center be going 24 hours since the Air Force has approved this?
Good question.
We are looking into that, sir, but there's going to be some funding that's going to come along with it, as well as some projects that would have to be constructed inside the fitness center, because it would not be the entire fitness center due to safety reasons, and it would have to be like a key card access.
Right.
And so there's a little bit more to go with that. The soonest it's even available to start would be the next year.
All right.
Yes, sir.
We're working that, and we're also working the live fitness instructor issue that a number of spouses have raised in other forums. So, good deal.
We're always looking for volunteers, sir. If we have volunteers that want to teach those fitness courses, please come let me know, and we'll get you hooked up.
All right. Thanks. Anything else? All right. We're going to wrap it up. Thanks, everybody, for coming out. Thanks for all you do and all your support. If you're a military member, I really appreciate the feedback. We're going to take some action on this and get you more feedback within 3 days. Have a great night and be safe driving home.